The INNOVATE study was a randomised controlled trial of 150 patients with Waldenstrom's macroglobulinemia, either treatment naive or patients with relapsed disease. And patients were randomised to the addition of ibrutinib to 8 doses of rituximab or rituximab and placebo. And the primary endpoint was progression-free survival. However, there were also other important secondary endpoints, major response rates, changes in hemoglobin, and patients' quality of life, in addition to some safety data and tolerability data. So in terms of the primary endpoint, the 30-month progression-free survival in the patients who received ibrutinib with rituximab was 82%. And that was highly significantly different to the progression-free survival of only 28% in the patients who received rituximab monotherapy. Furthermore, the overall response rates were substantially higher in the patients receiving ibrutinib, with a major response rate of over 70% and a sustained increase in their hemoglobin of over 70%. And even more importantly than the increase in the hemoglobin, the functional assessment for cancer therapy's quality of life score in patients with anemia showed a substantial, meaningful difference in quality of life in more than 70% of patients. In terms of tolerability, there were the recognised minor side effects of ibrutinib, namely some diarrhea, nausea and arthralgias. And there certainly was a higher incidence of atrial fibrillation in some 12% of patients, bearing in mind, however, that patients were on their ibrutinib for longer than the patients who were on placebo. There was also a higher rate of hypertension at about 14%. But what was also important was the addition of the ibrutinib to the rituximab substantially reduced the number of infusional reactions and also the IgM flare that is traditionally seen after the use of rituximab in patients with Waldenstrom's. So all in all, this study demonstrates a really important, clinically significant advance for patients in the treatment of both relapsed and, for some patients, treatment-naive Waldenstrom's macroglobulinemia.